Dr. Veronica Kelley, your Behavioral Health Director for San Bernardino County. A lot of changes have been taking place, and as you all are aware, since the beginning of COVID, we have had first weekly meetings with our contract partners so that we were all kept up to date and on the same page. But now things have sort of slowed down, but they still keep changing quickly. So we are going to opt for a once a month meeting on WebEx, and then one meeting will be via this link where you can view a recording of the most up-to-date information we have to share with you. We know that you all are very busy, as are we, so we want to free up some time so you can watch this video at your leisure and share it with your staff members. That being said, we want to let you know what's happening now. So as you know, I sit on the Community Vaccine Advisory Committee for the state of California. It is one of a few vaccine committees that inform the governor's vaccine task force. We have the Drafting Guidelines Committee and the Safety Committee. And we all meet separately, and all of our information is shared with the governor's task force, who then provides the information to all of the local public health departments in the state of California. At our last vaccine committee last week, we were advised that the state was once again changing directions. And so now Blue Shield is going to be taking over as the distributor and the deployer of vaccines for the state of California. Now that will be a phased-in approach. It will not happen today. So Blue Shield will be utilizing their years of experience with networks in order to establish a distribution plan where all vaccines are accounted for, like they are now, as well as a deployment of vaccines plan. And they will utilize their current network and other networks. That means all of the current vaccination sites that are certified by CalVax will have to be recertified through Blue Shield. When I asked the question specifically, Blue Shield was clear that sites would not be grandmothered in, that every site will have to be re-credentialed, and that not all sites might make it through the re-credentialing process. So that's just something to keep in mind. Again, this is a phased-in approach. Blue Shield will be starting to meet with all of the counties shortly. On last Wednesday, it was 9 days that they had been the contractor. So that is happening. In the meantime, though, we are still working with our current tier level. So remember, healthcare workers are all in Tier 1A, and some of us are already starting Tier 1B, which is for people who are 65 years of age or older in this county. Other counties do it differently, which is part of the problem, I think. And then teachers and childcare workers, that could be informal childcare workers as well. Emergency first responders that are non-medical, like fire and police. And food and agriculture workers. That's from people who are picking our food, to those who are packing it, to those who are selling it in our stores. So those are the groups that are currently moving forward. In this county, it is 65 years of age or older that we are on now with our healthcare workers. And all of you as behavioral health providers are also in that phase. The difference is I'm in administration. I'm not in a county clinic. I'm not out going to every clinic every day. Therefore, I would not get vaccinated yet. Some of you are in that same boat. But what we are doing in the Department of Behavioral Health is we certified through CalVax 2 of our county clinics so that we could be prepared when it was time for our clients to get vaccinated. Right now we have 3,065 clients who are 65 years of age and older. And what we all know is they're going to need assistance registering on the Vax site, as well as finding the place to go to get the vaccination. So to help, we wanted to set up our own county site. So we are working currently with the Department of Public Health. We are receiving our freezers now. And our hope is, once everything is completed, that we will be able to use our vaccination sites as a semi-closed site, meaning that we would be open for our staff, the ones who are supposed to get their first and second doses, who are in that tier process, and your staff who are in the tier process as behavioral health, so mental health and substance use disorder providers, and all of our clients who are 65 years of age and older, and that we will be ready for the next age group. because what we've also been told at the Vaccination Advisory Committee is that age will be our guiding principle. That is what's going to move people forward. So we will know what the next age group is. Our next meeting is on February 17th, and so I'll have more information for you at our live in-person, in real-time, not in-person, in real-time WebEx that we're going to be doing. So that's where we are right now with the vaccine. Another thing I wanted to point out to you is that the Department of Corrections and Rehabilitation, CDCR, is having meetings with the county mental health plans to talk about how they can better coordinate the release of parolees and people who are being released from prison who have a substance use disorder, in particular those who have been started on medicated assisted treatment while they were in custody. That's very exciting because unlike the mental health side of prisons, substance use disorder is handled by the medical side, and the two shall never speak. So we are working with CDCR to have a more streamlined approach so that we can better serve folks who are coming out of our prison system and help them also have recovery from addiction. And then finally, the Behavioral Health Stakeholder Advisory Committee has started to meet again. We are meeting this week, and that is to begin talks again about CalAIM, California's Advancing and Innovating Medi-Cal. Remember, CalAIM was on hold for an entire year while we've gone through this pandemic. And what we know is that the state has gotten waivers from the Centers for Medicaid and Medicare Services, CMS, but it really was waivers to continue business as usual with some tweaks, right, with regard to telehealth and getting client signatures and such. We're going to be now revisiting how we are going to advance and innovate Medi-Cal for the state of California. That includes how we are going to be addressing population health. That's specific to our managed care plans. How we are going to be doing enhanced case management, and how we're going to be doing in lieu of services. Again, those things are really on the managed care side, but there are some requirements that those things need to be done in conjunction with the mental health plan and the substance use disorder plan. So that's exciting. We also are addressing things like medical necessity. How much time do we have? You know, the way we open a chart now is we need to have a diagnosis. But for us in behavioral health, that diagnosis is harder to come by. Think about how much time I spend in my doctor's office with a complaint and how long it takes the physician to figure out what I have. But they get to bill for me the moment I come in, not for us. So we have advanced that. We are also looking at how that can be advanced to our EPSDT community so that our children's Medi-Cal has that same leeway in the beginning until we come up with a diagnosis. And that is really important, especially for those we serve in the substance use disorder side of the house. For those of you who know, we're not sure, is this methamphetamine-induced psychosis or is this schizophrenia? We need time so we can see if someone can clear with a little bit of time. So that's exciting. We also are moving forward with payment reform, which will help us all in things like documentation and address our risk for disallowance. So we have our CFO is sitting on that committee, and we've moved a little bit. It's gone from talks of an IGT, an intergovernmental transfer, to a per user per month, back to an IGT. So we will have more information to share with you, hopefully, at our next meeting. And also, if there's any high-level things, we will always invite our deputies who are over those particular subject matter experts to come and speak with you during our WebEx of our contractor partnership collaboration communication. So that's where we are for today. Today, obviously, we know that in the next few weeks, a lot of things can change. But we hope that this will streamline information for you. It will provide continued communication, but reduce the amount of time you have to get on a WebEx that's at a scheduled time, and you can watch this at your leisure. So pay attention to your emails. We will be sending you reminders about when the WebEx will be, and we will send you a link to the recorded versions. And until next time, I want to make sure that you understand how important you all are to us as partners in behavioral health delivery for San Bernardino County. And again, I'll catch you on the well side.